welcome to Maxi Life Wellness Fridays featuring cancer awareness, general signs and screenings. Again, I'm Patricia Bermudez. He's on your host for this morning. Today, we will be joined by one of the country's best doctors in oncology. This is most especially relevant now because World Cancer Day was commemorated just last February 4. This session will be very helpful for all of us so we can educate ourselves about cancer to eliminate the fear, misinformation, and social stigma, and because early detection is very important in management and treatment of the disease. If detected early and aware of the signs and symptoms, there are better chances of recovery. At this point, let me introduce to you our speaker for this session. Our speaker is the chief of the section of oncology in the Department of Medicine at the Asian Hospital and Medical Center and the Las Piñas Doctors Hospital. She is also a member of the Philippine Society of Medical Oncology. Ladies and gentlemen, dear Maxicare members, let us welcome Dr. Cherry Marquez. Good morning, Doc Cherry.
Hi.
Hey, Doc Cherry, thanks so much for being here. Like I said, I shared with you a pain point that I have a friend who recently found out she has cancer. So I'm looking forward to this, especially because is the proper term on the national level, National Cancer Awareness Month? I think that's the proper term for it, Doc. Tama ba? National Cancer Awareness Month?
Yes, it's Pat. February Awareness Month. So this is a very cancer is quite common. In fact, a few years ago, Philippines had the highest rate of cancer in Asia. No? So it's a very common disease now.
Wow. All right. Well, even more that I am going to be so glued to what you're going to be sharing with us this morning. Thanks, Doc Cherry, in advance. Here she is, ladies and gentlemen, Doc Cherry Marquez.
Again, good morning. Thank you for to speak on this topic on cancer prevention and screening. So, why should we talk about cancer? Last year alone, according to Globocan, which is an international database under the World Health Organization, there were about 19 million new cancer cases worldwide, and unfortunately, second leading cause of death globally. It is estimated that 1 in 5 people will develop cancer during their lifetime, and 1 in 11 women would die from cancer. The top 5 most frequent cancers in men, the top 1 and 2 would be lung and prostate, which would be about 30% among men, while for women, 25% will be due to breast cancer. In the Philippines database estimated that for last year, there were about 153,000 new cancer cases and 92,000 Filipinos died from cancer. It is also estimated that 1 out of 6 Filipinos would develop cancer before the age of 75. Fortunately, 1 out of 10 Filipinos die from cancer. From our statistics, national statistics, cancer is also ranked as the second leading cause of death. And these are the top 5 cancer sites in the Philippines. No? As I mentioned earlier, for the women in the Philippines, breast cancer is still number 1 site for cancer, followed by cervix, colon, rectum, the lung, and the ovary. For men, the top site will be lung, followed by colon, prostate, the liver, and the blood with leukemia. So in the next 40 minutes or so, we'll be talking about what is cancer, what causes it, what are the possible risk factors that will increase our risk to develop cancer, and can cancer actually be prevented? These are my sources for the talk. So what is cancer? Normally, our cells, which would make up our body, would function with their own jobs. The cells would divide in a normal fashion. So if some cells will be damaged, they need to be repaired first. Uh, but if the damage cannot be repaired, then these damaged cells would have to undergo suicide or cell death. No? So, and then the new cells will come in. But in cancer, the cell growth becomes unregulated, uncontrolled. So the new cells, even the abnormal cells, also multiply without being repaired. So cancer starts from a single malignant or cancerous cell and multiplies such that it becomes a mass or a tumor. And the hallmark of malignant cancer versus a benign tumor is tumor can invade. It can invade through the neighboring tissues. It can go to the lymph nodes or yung kulani. It can invade the blood stream, and it can spread to distant sites. So, for example, cancer that came from the lung, it can go eventually to the bone, the brain, or the liver. Lung cancer, but it has spread or metastasized to a different site. Whereas if we hear the term benign or a benign tumor, a growth, uh, the cells will multiply but not invade into the neighboring tissues, and it also cannot spread. So what causes cancer? Basically, there's a problem of a mutational change in the gene. So in the cell, there's the effect of genetic mutations, some of which are inherited, plus the effect of the environment, like exposure to some cancer-causing substances, or what we call also as carcinogens. And both of these would have an effect on the cells and eventually can promote cancer development. Sometimes when patients come in, they tell, oh, there's no history of cancer in the family. Where did I get this cancer? Is this hereditary? Around 5 to 10% of cancers are hereditary, or they came from mutations that are inherited. But 90 to 95% of the mutations are because of the aging process that our bodies undergo, and also the exposure to carcinogens. So 90 to 95% are what you call due to random or sporadic mutations. What are the risk factors that can increase our risk to develop cancers? Be increasing age, older, there's also a greater chance for mutations to accumulate. There's also higher risk for cancer. Of course, there's also a family history. Yes, if there is family history of cancer, then okay, so let me continue with the risk factors. For increasing age and family history of cancer, these risk factors, we cannot really do anything about them. No, we cannot modify them. But in the succeeding risk factors for cancer, these are the things that we can do something about. So important risk factors for cancer would be cigarette smoking, alcohol intake, betel nut chewing, which can be seen in some parts of the country, such as in the Cordilleras. Being overweight or obese has also been found out to be an important risk factor for cancer in the past 5 to 10 years. Being overweight or obese, you can measure first if you are in a healthy body weight by using the body mass index, or the BMI, which is the ratio of a person's weight and height. And the target is a BMI of less than 25. Another risk factor for cancer would be infections such as human papillomavirus, which causes most of the cervical cancers, and hepatitis B and C, which causes liver cancer. Risk factors also are exposure to radiation, including ultraviolet light radiation from the sun, and specific chemicals such as those found in some workplaces. Can cancer be prevented? Yes, according to the World Health Organization, some 30 to 50%, half of all cancers are actually preventable. And many cancers can be cured if diagnosed early and treated adequately. So let's go to the prevention. For primary prevention, that means we want to stop cancer before it acts. So that means we need to reduce or eliminate our exposure to the carcinogens that I've mentioned before. How do we do this? Healthy lifestyle choices and being vaccinated. So first, risk factor, tobacco smoke. This is the most important carcinogen known to man. A tobacco smoke contains over 4,000 chemicals, 70 of which are known or suspected carcinogens, and tobacco smoking would be responsible for almost 1/3 of all cancer deaths. Of the substances found in cigarette smoke, like butane, toluene, methanol, acetone, carbon monoxide, arsenic. These are things that we normally would not want our bodies to be exposed to, but these are things that we can be exposed to with cigarette smoking. It's common knowledge that cigarette smoking can cause lung cancer. In fact, 9 out of 10 lung cancer cases would be due to smoking. But in fact, tobacco can actually cause cancer almost throughout the body. So see here that it can affect the mouth, the throat, the voice box, esophagus, the liver, stomach, pancreas, colon, rectum, the kidneys, and the urinary bladder, and the cervix for women, and also the blood through leukemia. Tobacco smoking would increase the risk for cancer, especially if there's a higher number of cigarettes smoked per day, if there's a longer duration of the smoking habit, as well as the inhalation technique. Of course, there's higher risk for those who are actively smoking, but there's also a high risk for developing lung cancer and respiratory diseases or lung diseases for the secondhand, for those who are exposed to secondhand smoke. So for a smoker, he can affect his children, his family, his colleagues as well. A study has shown that there is no safe level. Even smoking less than 1 cigarette per day consistently increases the risk of dying from lung cancer by about 9 times compared to those who are non-smokers. And of course, if there are higher number of cigarettes per day, like 1 to 10 cigarettes per day, then the risk of dying will go to even 12 times higher than that of a non-smoker. So the recommendation is to stop smoking if you're already smoking. And if you haven't started, then please do not start smoking because it has really an addictive substance in it, the nicotine. So it will be a hard habit to break. There are many benefits of quitting smoking, especially with the lung and the heart function. And it can be seen as early as within 20 minutes of quitting. For the next carcinogen, obesity. One of the leading cancer experts in America commented that obesity is now on its way to replacing tobacco as the #1 preventable cause of cancer. And you can see here that there are several cancers that are associated with obesity, like cancer in the esophagus, in the breast, in the blood, in kidney, in the ovary. But most importantly, the biggest contributory factors, the biggest contribution of obesity will be to the cancers of esophagus and the endometrium, or the lining of the uterus. Obesity and overweight contributes to as many as 1 in 5 cancer-related deaths. So one factor that would contribute to obesity, of course, would be diet. And there is increased cancer risk seen with a diet that is high in fat and low in fiber. A few years ago, the World Health Organization has already classified processed meat to be a carcinogen. In fact, if we consume around 50-gram portion of a processed meat every day, there is a higher risk of colorectal cancer. It can increase the risk by at least 18%. Red meat such as pork, beef, and lamb are classified as can probably cause cancer, so not yet sufficient evidence. So what are the foods that have been studied for cancer prevention? So broccoli, cauliflower, cabbage has been shown to protect against head and neck, esophageal, stomach cancers. Whereas lycopene that is found in tomato and watermelon can protect against cancer of the lung, the stomach, prostate, colon, oral cavity, and esophagus. Soy can also protect against some types of cancer, but its role in breast cancer prevention is still not really that defined. No? So it's not really, for now, it's not that recommended yet. For high fiber diet, this has been shown to protect against colorectal cancer. So the recommendations in order to prevent obesity or to reverse it is to eat more of vegetables, fruits, lean protein, whole grains, and soups. Avoid the high fat and processed food. Avoid foods and beverages that are high in sugar. And aim to consume calories that we can actually burn. Aim for increased physical activity, at least 30 to 60 minutes per day on most days. And for those who are overweight or obese, aim to lose 5 to 10% of the body weight as first goal. A third factor that we can try to eliminate or prevent in our daily lives will be alcohol consumption. It causes around 3.5% of cancer deaths in the US. So it may seem like a small number, but it has a strong synergistic effect when combined with smoking. So the harmful effects are really multiplied when smoking plus drinking alcohol would be combined. And alcohol has been proven as a carcinogen, such that the alcohol drinkers, especially if they are moderate to heavy drinkers, would have higher risk for developing certain cancers, such as oral cavity and throat cancers and voice box or laryngeal cancer. It is also associated highly with esophageal cancer and liver cancer, breast and colon and rectum. Now, like for the cavity, oral cavity and throat cancers, for heavy drinkers, it's 5 times higher, the risk, compared to the non-drinkers. But if the drinker will also combine it with smoking, the risk can even go as high as more than 100 times higher, no, than a non-drinker. So the recommendations will be to avoid alcohol, but if it cannot be avoided, limit the number of the alcoholic beverages that you drink per day. So for women, we should limit the drink to just 1 drink a day. And for men, just limit drinks to 1 to 2 drinks a day. So what is the definition of a standard drink? It is about 12 ounces of beer, 5 ounces of wine, and 1.5 or 1.5 ounce or a shot of an 80 proof liquor. Of course, we should not drink heavily. We should not binge drink. Red wine is no exception. It's still considered alcohol, no? So it's not proven safe against cancer. And last but not the least, avoid using both alcohol and tobacco at the same time. Radiation can also cause cancer, particularly ultraviolet light, the medical x-rays, radiation in the workplace, and radiation accidents like the ones in Fukushima or Chernobyl. And usually this radiation can cause cancer on the skin, the blood, and the thyroid. So this is an example of skin cancer developing on a sun-exposed part of the body due to excessive sun exposure. So we should use sunblock, at least SPF 15, and avoid sun exposure, particularly when it's the hottest, between 10 a.m. up to 4 p.m. Some of the infections can also cause cancers, and fortunately, some of them we can already prevent by vaccination. So hepatitis B and C can cause liver cancer. Human papillomavirus causes almost all the cervical cancers and can also cause oral, penile, vulvar, and vaginal cancers. Helicobacter pylori is a bacterium which causes stomach cancer. And HIV, or human immunodeficiency virus, while in itself does not, but because the patient becomes immunosuppressed, it can make it high risk for that person to have lymphoma, Kaposi sarcoma, and other cancers. So I'll just tackle briefly hepatitis B and human papillomavirus because these are quite prevalent in our country. So chronic hepatitis B and C can cause liver cancer. As of 3 years ago, there's around 8.5 million Filipinos with chronic hepatitis B infection. And about 1 out of 4 persons born with hepatitis B can die from liver cancer if it is not detected early on. 60% of liver cancer cases are found to have chronic hepatitis B. And 43% of liver cancer deaths are due to hepatitis B. So there is a very strong association between hepatitis B, liver cancer, and death. So how is hepatitis B transmitted? First is blood, through direct blood-to-blood contact, like mother-to-child transmission during childbirth, doing tattoos, piercing, even in the barbershop, sharing of needles, sharing of hygiene equipment such as razors, toothbrushes, earrings, needle prick injury in the healthcare environment, and also transfusion of contaminated blood, although that is already very rare nowadays because there is screening for that. Hepatitis B is also transmitted through sexual contact. So how do we know if we have hepatitis B? Then we should be screened or tested. HPV, there's around more than 100 types of HPV, no? And most of them would cause the common warts, or I think the kulugo, which we see on hands and feet. These are contagious, spread by touch, but not cancer-causing. Around 40 types of HPV are the genital HPV, also spread by skin contact, but usually during sex. So this makes it the most common sexually transmitted infection, and many actually would not be even aware that they have this infection. So most of the infections will be cleared out by the immune system of the person after a few weeks or months, but some infections would persist in the body. Can make a person at risk for cervical cancer. So HPV causes nearly all types, all the cervical cancer cases. And 70% of these would be due to the 2 types, HPV 16, 18. And as I mentioned before, HPV is also linked to other types of cancers. The recommendations for hepatitis B, of course, we should screen in the high-risk groups, also vaccination. In the Philippines, because of their very high rates of hepatitis B, we have the so-called universal vaccination. Vaccination starts even during the first 24 hours that a baby is born. We already give them the first shot out of the 3 shots for hepatitis B. Of course, if a person is already known to have chronic hepatitis B infection, there should be close follow-up in order to determine if it is liver cancer. Human papillomavirus, of course, it's recommended to practice safe sex as much as possible, limit only to 1 partner, sexual partner. And it's also a good thing that vaccine for HPV is already available in the country. At least 3 types of vaccines are available. For occupational and environmental exposures, which accounts for about 4% of cancers. These are the high-risk jobs, those that are involved in the manufacturing of dye, gas, rubber, glues, varnishes, isopropyl alcohol, hardwood furniture, PVC, and minors who can also be exposed to radioactive substances. And common sites for cancer for these workers may be the lung, skin, the blood, nasal sinuses, and liver. So we want our workers to be fully aware and properly educated on the jobs and what to do in their work environment. They should be provided with the appropriate protective gear and should undergo regular physical examinations. For secondary prevention, so we want to test to check for cancer in a person without symptoms. So earlier in the primary prevention, we want to avoid or eliminate our exposure to the carcinogens. In the secondary prevention, we want to check for cancer in a person without symptoms. So they feel well, they feel okay, no? But still they will be tested just to make sure to identify cancer early in their development so that the chances for cure will be greatly improved. So this is also what we call screening and early detection. In fact, there are only 3 cancer screenings that are presently approved and being done routinely, and has shown to actually improve patient survival and decrease the risk of dying from these particular cancers. These are breast cancer screening, cervical cancer screening, and colon cancer screening. For prostate cancer and lung cancer, their screening is not routine, and I'll just tackle briefly later on where they can actually be applied to a certain subgroup of the population. So for breast cancer screening, for average risk women, average risk meaning the person doesn't have a personal history of breast cancer or a family history of breast cancer. She also doesn't have the mutations such as BRCA1 or BRCA2. So the best screening tool will be a mammogram. This is an X-ray of the breast, and this is to be done every year starting age 40 years old. So it has been shown that mammograms can detect masses or breast cancers also as early as 2 to 3 years before it can be fed by the patient, or by the person. So this is where the stage 0 and stage 1 breast cancer are usually detected. So there's a higher chance for cure for those cases. Aside from mammogram, starting age 20, and women are encouraged to be familiar with their own breasts and to report to their doctors or their healthcare provider if they notice some changes. A clinical breast exam is one that is done by the doctor, and usually this is part of a routine checkup every 3 years for those aged 20 to 39, and every year for women 40 and above. So when you do a self-breast exam, do it about once a month. If the women are no longer in their are already menopausal, then they can do it any time of the month. But for those who are not yet menopausal, do it. The best time to do it will be about 7 to 10 days after the menstrual period starts. So there will be less chances of feeling lumps and swelling that are just due to the hormonal changes about the body experiences during the menses. Examine the breast and the armpit with a raised hand and keep the fingertips close together while examining. So what are the things we should watch out for? Look out for these changes. So just to illustrate, look for areas if is there thickening in the area? Is there dimpling in the breast? Is the nipple crusted, or is there scaling or peeling? Is there redness or warmth in the breast? New fluid coming out from the nipple, and sores, bump, The a nip, before it's not sunken and now it gets inverted. Is there a new shape or size? Is the one breast much bigger than the other? Is there an orange peel skin, or is there a hard lump? So if you notice some of these or one of these, then please consult your doctor. Another very successful cancer screening will be that for cervical cancer. So shown here is a pap smear being done by a doctor. And this is according to the US Preventive Services Task Force. The guidelines will be for women ages 21 to 29. The screening should be with a pap test or a pap smear every 3 years. Then for those aged 30 to 65, any of the following 3 tests. So every 5 years with a high-risk HPV test only, every 5 years with a combination of pap smear plus a high-risk HPV test, or every 3 years if only a pap smear is done. Now, for some women with other risk factors such as HIV, immunosuppression, diethylstilbestrol exposure, or if they already had before cervical cancer or a precancerous cervical lesion, then they will need to probably have a more frequent screening. And these are the women or the people who are not actually recommended to undergo cervical cancer screening. Those who are younger than 20, those who are older than 65 years, but with adequate prior screening with normal results, not at high risk for cervical cancer, and also for who have already undergone a total hysterectomy. So the uterus and the cervix has already been surgically removed, and they have no history of a high-grade cervical lesion or cervical cancer. And last but not the least would be colorectal cancer screening. This has already been also shown to improve a patient's survival because it can detect cancer early on. Usually, colon cancer stage 1 and 2 may not present with any symptoms. So, pwedeng normal pa rin yung pakiramdam ng tao. So, this is the only way for the cancer to be detected at that early stage. So, colon cancer screening is advised to start at age 45 years old. And one can do either the stool-based test or a visual exam of the colon and the rectum. So, under stool-based test, we have the highly sensitive fecal immunochemical FIT test or the highly sensitive guaiac-based fecal occult blood test or GFOBT. These are to be done every year. Also, the multi-targeted stool DNA test every 3 years. I think in the Philippines, what's available are the FIT and the FOBT test. Or we can do also a visual exam of the colon and the rectum. Most popular would be the colonoscopy every 10 years. So if normal findings now, then the next colonoscopy can be scheduled after 10 years. Also, there's virtual colonoscopy. So basically, this is done with CT scan, and the CT scan would produce 2D or 3D imaging. This is to be repeated every 5 years, or a flexible sigmoidoscopy every 5 years. When a colonoscopy is done, the patient is placed under sedation. This is around 15 to 30 minutes. And the tube, a flexible tube, is inserted through the anus. And aside from visualizing possible masses, there are growths such as polyps that can already be removed during the colonoscopy. Many polyps can also develop into cancer. After maybe 3 years, 5 years, it can develop to cancer. So the removal of the polyps during the colonoscopy is actually already cancer preventing. So for prostate cancer screening, presently there is no standard or routine screening test for prostate cancer, meaning even if we do the digital rectal exam or the blood test prostate-specific antigen test or the PSA test, even if the prostate cancer can actually be detected early using this test, there's no evidence that doing this would decrease the risk of dying from prostate cancer. Now, men should not be screened unless they have received the information about risks and benefits of prostate cancer screening. And discussion regarding screening may start at these age groups. So age 50 for men who are at average risk for prostate cancer, age 45 for men at high risk of developing this cancer, particularly for those who are African Americans, and for men who have a first-degree relative, like a brother or their father, diagnosed with prostate cancer at an early age. The age for screening will go even lower at age 40 for men who are even at a higher risk, no? With more than one first-degree relative with prostate cancer at an early age. And finally, for lung cancer screening, it has been shown in a study that annual screening with a low-dose CT scan in heavy smokers can decrease the risk of dying from lung cancer by up to 20%. So this lung cancer screening would just be recommended for smokers with the following criteria. No? So not for everyone. Let us remember always that early detection saves lives. Now, I mentioned earlier that for secondary prevention, we want to see if there is cancer in people who are feeling well, no symptoms. What about for those who feel some symptoms? There are changes that they have noticed. So these are the so-called warning signs for cancer with the mnemonic of caution us. So let's watch out for this. And if we notice this in ourselves or in people around us, then maybe it's time to see a doctor. Like are there changes in bowel or bladder habits for about 2 months or so? Like, is there constipation now? Or is there alternating diarrhea and constipation? Is there a problem with urination? Is there a sore that does not heal? Unusual bleeding or discharge? Like, is there blood in the stool, blood in the urine, nose bleeding? Is there a thickening or lump in the breast or other parts of the body? Is there indigestion or difficulty swallowing? Or sometimes it's feeling of fullness agad, no? Busog agad. Is there an obvious change in the wart or a mole? Like, is there a change in the size, in the color, in the margins of a mole? Is there a nagging or a persistent cough or hoarseness for at least 2 weeks? Is there unexplained anemia, particularly for men? Is there also sudden unexplained weight loss of about 10 pounds in the last 6 months? So if we notice this in ourselves, any of this, then it is most probably a good time to see a doctor. So for tertiary prevention, this would be already for patients who are diagnosed with cancer, who are presenting with symptoms. And the treatment of these patients, the goal would be to prevent further complications and further progression or spread of the disease. Now, the first decision is the most important decision for success in cancer treatment. And this should be done in a multidisciplinary or team approach. So usually the treatment of cancer is complex and it would require more than just one doctor or one group taking care of the patient. So these are the primary of treatment in cancer. We have surgery carried out by the surgeons, radiation therapy carried out by the radiation oncologist, and systemic therapy, including chemotherapy, hormonal therapy, biologic therapy, targeted therapy, and immunotherapy. And as I mentioned earlier, the best approach would be a team approach to cancer treatment so that everything will be properly coordinated. And in the middle of the decision-making team, of course, is our patient. So as I go to almost to my last slide, this is just a reminder for us on decrease cancer risk. Do not smoke or use any form of tobacco. Smoke free. Let's enjoy a healthy diet, more of vegetables and fruits, and high fiber. Breastfeeding. Breastfeed as long as possible because this can also reduce the mother's risk for breast cancer. Let's vaccinate our children against hepatitis B, HPV. Avoid too much sun. Use sun protection. Let's reduce indoor and outdoor air to increase risk for lung cancer. Let's be physically active at least 30 minutes a day and limit alcohol intake. And let's be screened, especially for cancers of the breast, the colon, and the cervix. Thank you for your attention. Have a good day.
Thank you so much, Dr. Cherry. You know, I learned so much about the key risk factors and just even the last slide that you just shared. Uh, Actually, the regular screening and regular checkups, those are really important. And thanks for emphasizing that even more in your talk. This also encourages all of us to change our bad habits and try to live our best life and live a healthier lifestyle. Nako, ang dami kong questions. And I'm looking at our Q&A button, and so many people have great
That's good.
questions to ask. Great job, people. Of course, we'll be picking these questions for Dr. Cherry to answer. But for now, I will call on someone who will facilitate this Q&A. Today's moderator is a fellow of the Philippine Society of Medical Oncology and the Philippine College of Physicians. She is also the head of Philippine Society of Medical Oncology's Ad Hoc Committee on CPGs in 2020 and currently is a training officer of ng Hospital ng Muntinlupa Department of Medicine. So let us all welcome for our Q&A portion our moderator, Dr. Maria Pamela Patdu. Hi, Dr. Patdu.
Good morning, Ms. Pat. Thank you for that introduction. Thank you, Dr. Marquez, for the enlightening lecture on the often scary topic of cancer. No? Let us kick off the discussion. I'm very happy that our participants are very lively. There's a flood of questions in the Q&A. We'll try to accommodate as much as we can today. But let's kick off the discussion with the poll questions. You know, we are in the digital age. There's a lot we learn about cancer, and we must be very wary in distilling the truths from the myths. So, we were asked earlier, among these statements, which do you think is true? In the poll, majority answered the correct answer. That if you have a family history of cancer, you may be at an even greater risk of developing cancer. In relation to this, let me go to one of the questions from our participant, Mr. Severino. He asks, so if we remove all the environmental factors and the carcinogens in our life, clean living, kumbaga, can we still have cancer by virtue of these inherited genes? No? This is in relation to those who have a family history of cancer and who may be at a higher risk of developing cancer. What do you think, Dr. Marquez?
Yes. Even if we remove all our exposures to carcinogens, there will still be some risk for developing cancer. But of course, that risk will be greatly reduced. In the WHO says that if we just eat healthy, maintain a healthy weight, do not smoke and do not drink, we can already prevent around 40% of the cancers. No? So it's a good job if we can already eliminate or at least reduce our exposure to carcinogens. Again, remember around 5 to 10% of cancers are also from inherited mutations. So that's something we cannot do something about. But even if you have that mutation, you still have to also live a healthy lifestyle so that you will not further increase your risk for developing cancer.
Okay, thank you, Dr. Marquez. That was very clear, no? So let's go back to the questions that we posed to you earlier. So is this really true, Dr. Marquez? Can you go back to the previous poll question? Okay. So really, is there no cure for cancer? No. Dr.
There
Marquez.
is cure for cancer, especially if the cancer is detected early. Like for breast cancer, thyroid, prostate cancer, 5-year survival goes higher than 90%. No, if it is detected early and treated adequately. So there are some cancers that are actually curable.
Okay, so you are very lucky to be supported by Maxicare, no, in this pursuit for early detection of cancer, no. So let's go to the next. Are all lumps or large masses detected in the body cancerous? And I will relate that also to one of the questions from an anonymous participant here. He or she asks, I have a lump in my armpit. Is this cancer? So Dr. Marquez earlier mentioned about the terms of malignant versus benign. Can you tell us more about this, Dr. Marquez?
So malignant versus benign tumors. So when we say benign tumors, they are growths, but they will just grow locally. They will not invade. They will not spread to another organ. So examples of this would be like a lipoma or accumulation of fat cells. If you have that mass in that armpit, of course, we would recommend that you see a doctor so that it can be properly assessed, whether it would be more likely to be just benign or non-cancerous, or if it's suspicious for cancer. So with the question, are all large masses cancerous? Well, no.
Okay, so some are benign, no? But if you have doubts,
Yes.
never fear, just consult. Okay? All right. So then this one is easy. No one answered this one. Only women have breast cancer. Dr. Marquez?
So men also have breast cancer. Around 1% of breast cancer cases are found in men. Okay, so men should also be mindful, no, of any changes in their breast.
Thank you, Dr. Marquez. So we go on to the next slide. The next poll question, please. All right. So there are a lot of myths, no? They've heard a lot about it, no? So the first myth here is very common, and I will also segue it to one of the questions of our participants. So are artificial sweeteners, do artificial sweeteners cause cancer? And there's also a question from Mr. Severino again. Do cancers feed on sugar? And I would surmise the corollary question to this is, should we deprive cancer patients altogether of all sugars?
So for the first one, artificial sweeteners, there's no good evidence to show that they are cancer causing. No? So that's why they are still being approved by the FDA. Of the sugar, Dr. Rapatlu? The question is, thrive on sugar?
Do cancers feed on sugar? So we've seen this a lot in the internet, no? A lot of the articles say cancers feed on sugar.
And many patients also ask me that, no? So the sugar actually is quite good, no? And it is used not just by cancer cells, but also by our healthy, normal cells. So it is not true that cancer will feed on sugar. We will deprive the cancer patient of all the sugar in the body, then the patient will turn out also to be malnourished. I think if in correlation with what I mentioned earlier, obesity being now one of the risk factors for cancer development, we just have to be, even though will not sugar, but excess sugar in our diet promote obesity. So, which is a risk factor for cancer. So there's a connection, but the sugar intake in itself is not directly correlated with cancer. And let us not deprive sugar or to our cancer patients. No, they also need that, like carbohydrates. Carbohydrates are when they are all broken down or digested would also become sugar.
Okay. Everything in moderation, no, Dr. Marquez? Okay.
Yes,
So
yes, that's right.
there are a lot of questions on the diet in terms of prevention. No, you touched a little bit on cancer prevention and soy. So from one of our participants, they asked, can veggie meat made of soy and gluten uh, be very good for preventing cancer? I think you mentioned a little bit. Maybe we just need to reinforce.
There are actually different reports on this or different results on studies. They say that some soy, their ingredient would be the isoflavone and can increase estrogen. But this is the natural soy that is found in food, then it is usually safe, especially if the intake is just maybe 2 portions a day, like tofu, no? So it's okay. But if we take soy supplements, like some herbal supplements, so those are the ones that they have found out to actually increase possibly estrogen and maybe increase the risk for breast cancer or cancer of the uterus. So if it's just soy that is seen naturally occurring in food, I think it's safe. So veggie meat, I think, is okay.
Okay. So, thank you, Dr. Marquez. So, the diet is a popular question, no? Maybe the top two cancer myth question of the decade is, I read that dairy products raises the risk of breast cancer. How true is this? And is this the same across all types of milk? Like, is this the same for low-fat milk? Since we also need to drink milk, especially as we age, what would be the average milk consumption you can recommend in relation to this?
Actually, based on studies, there is no evidence that consuming dairy products will increase risk for cancer. So it is safe to take milk or dairy products. And of course, if we want to avoid fat in the diet, you can also take the reduced fat version of milk, no? So this is a myth. So there's no truth that taking dairy or milk will be increasing the risk for breast or for cancer in general.
Okay, thank you. Can we flash the remaining cancer myths in the poll question? Okay, so here they said cell phones can cause cancer. Allah, scary. Oh.
Okay, so everybody has cell phones, right? But actually, this is not true. Cell phones can emit some type of radiation, but these are the so-called non-ionizing radiation or low-frequency radiation. So these do not cause cancer.
Okay. All right. So the next one is cancer is contagious. Dr. Marquez, you mentioned infections that can predispose to cancer like hepatitis B, human papilloma virus, or the HPV, HIV in your lecture. So one of our participants is being proactive here. He asked, how can HPV infection then be avoided? No? So if it's one of those, no, that can predispose to cancer, how can it be avoided?
So HPV infection is sexually transmitted. I mentioned earlier there are also some HPV types that will just cause the common warts, but some of them would cause a sexually transmitted infection. So best to practice safe sex practices and limit to one sexual partner. But sometimes it will still not be enough. Just this, even it will still be HPV infection can still exist. And as I mentioned, Usually, the infection can be eliminated or resolved spontaneously just by the body's own immune system. So in order to prevent, I mentioned earlier that there's also vaccination now available. And vaccination for HPV is recommended even as early, to start as early as 9 years old and up to about 45 years old. And best to give the vaccine to those who are not yet been exposed to the HPV, meaning there's no sexual contact yet. That's the best time to give it. And there are different types of vaccines. The best one would be the one that will protect against nine types. No, it will protect against types that will cause the cancer and 2 types that will cause the common warts. So if you have a choice among all those 3 vaccines, then you choose that one that will protect against 9 types of the virus.
Okay.
So is cancer contagious? In itself, it is not. So if a cancer patient is there, you don't have to be scared that you want to stay away from the cancer patient because you might catch the cancer. So it doesn't get transmitted that way. Although there's a case like maybe organ transplant. No, if the organ that is being donated is from a cancer patient and being transplanted to another person, then there is a possibility that that cancer will be transmitted or transferred to that or that the patient now who received the transplant can also develop cancer, but that's very rare. No.
Okay, thank you for that, Dr. Marquez. So, one of the questions is, does attitude determine my risk of cancer?
Unfortunately, there is no evidence that our attitude will have an effect on our cancer risk. But of course, if we have a very positive attitude and we're the type who would, because of this attitude, would have a tendency to live a healthy lifestyle, like exercise more, eat properly, and then that can probably affect our cancer risk, but not just having a positive attitude per se.
Okay, so there are a lot of questions about cervical cancer. So let me just go back a little bit on HPV. No, one of our participants asked, I was vaccinated last 2012. Cervarix was used. Is it still possible that I will still have cancer? Siguro, particularly cervical cancer in this case. She has a family history. Okay, so I think it is a general question also from her. So she had Cervarix vaccine, but she also has a family history of breast and liver cancer. So will she still have cancer? Is it still possible?
Of course, no vaccine is 100% effective. And even if a person already has received like HPV vaccines, they are still also encouraged and they are still recommended to undergo screening, like pap smear or an HPV test. Why? Because there are many HPV types and there's around 12 types probably that would cause cancer. And those 3 vaccines that I mentioned, like Cervarix, Gardasil, and the latest is Gardasil 9, all those 3 vaccines, they will not be able to protect us against all the types of HPV that can cause cancer. So yes, there is still a chance for cervical cancer to develop. So we still need to continue cervical cancer screening even if we have already received vaccinations. And for that particular person who also asked, because of the history of breast cancer and liver cancer in the family, then they also have to consider that, discuss that with their doctor on how to be screened and liver cancer as well.
Okay, so that also responds to one of the questions, how to detect early for cervical cancer. Dr. Marquez mentioned your pap smear and your gynae consults for this. Okay, in relation again to screening naman for breast cancer, this is a very common concern. mammogram really hurts? Are there alternate methods for screening breast cancer? So yeah, the pain is really an issue for a lot, especially the older women.
I see. Yes, actually, that's very common problem or common concern, no? But for now, mammogram is still the standard, no? Screening tool for breast cancer. It is usually started at age 40. For women who are younger than 40, we usually utilize breast ultrasound. And then for patients who are already diagnosed with breast cancer, we often complement the mammogram with a breast ultrasound also. But for routine screening, still mammogram.
Okay.
Unfortunately, we will wait for, hopefully there will be a time in the future where there will be a less painful mammogram procedure, no?
Digital mammograms may be less painful than the
There are
usual.
some who say that the digital mammo is a little less painful
Okay.
than the manual.
Okay. So this one again, this is a very popular question. May I know if a biopsy procedure is really safe? Because there are some beliefs that biopsy can cause cancer cells to spread or trigger. It's a common clinic question. Dok, nung binayopsy yan, biglang lumaki. Yung bukol. No? Can the biopsy
No?
itself really trigger that?
So when a biopsy is done, the surgeons, they will also utilize techniques to make sure that will not cause the spread of the tumor. No, they will use like different instruments if they need to biopsy different sites. So this should not. This type of myth is incorrect. There's no evidence that the biopsy will ultimately cause the spread or the tumor to enlarge further. And hopefully, if we will not, if we will just remember this, then we will not be afraid of having to undergo a biopsy, especially when it is really needed and recommended. No? Kasi sayang ang oras, no? Para ma-detect agad ang sakit.
Okay. So, one of the questions here, no, I'll segue na. Why is liver cancer usually detected in a later stage? Probably they know somebody who has been diagnosed with liver cancer, and this is true. A lot of liver cancers are detected at a later stage. Why is this? And maybe what can we do about this? No?
Okay, so liver cancer, I mentioned earlier, some of them can be caused by Hep B or C. Some of them also from alcoholic cirrhosis, no? But most of the time, or probably most of the time, patients who are at risk for this, like hepatitis, or probably due to chronic alcohol intake, probably they're not that proactive, no? Only a few would actually be screened, no, for that. If for like with a liver ultrasound or some tests, no, blood tests, a tumor marker. So I think that's the reason by the time the person gets some symptoms like there is weight loss, there is abdominal enlargement, there is yellowing of the skin, poor appetite, then it's already quite a late stage already. So for patients who are, first you have to know if you have chronic hepatitis B, right? So you have to be tested. You have to know your status. So if you know that, or if you think you're at high risk for that because very heavy alcohol consumption, then it is time to be checked by your doctor early on. Maybe they will recommend monitoring by doing some imaging and blood tests so that hopefully liver cancer can also be caught at an early stage.
Okay, so for those who have risk factors, particularly cirrhosis, Dr. Marquez says you'll have to have monitoring. Just follow the instructions of your doctor. You have your Maxicare as your partner in this monitoring. So hopefully we can catch liver cancer earlier or even reduce the incidence of liver cancer as we take care of our risk factors like hepatitis B, alcoholic cirrhosis. No, this event of Maxicare seems to be generating a lot of proactive responses from our participants. One of the questions here um, is there a thing in clinics or hospitals where someone can undergo all kinds of cancer screening? Tinakot na ni Dr. Marquez tungkol dun sa mga cancer. So gusto na nilang makasigurado. How is there a package where we can undergo all kinds of cancer screening, or are there guidelines which cancer screening this patients can undergo? And probably the more pertinent question also is, if they go to Maxicare, what doctor do they ask, no?
Okay, so as I mentioned earlier, there are actually just three cancer screenings that are routinely or that should be routinely done. So for women aged 20 and above, you can already start the pap smear test. Women above 40 and above should also already start on the yearly mammogram. For colon and rectal cancer screening, men and women at age 45 and above should start getting screened, whether it's a stool-based test or colonoscopy. So these are the things you need to discuss with your healthcare provider, with your doctors. But I would caution you against maybe just going to the laboratory at random and ordering all the screening tests. No, sometimes patient would come to me, Doc, I have everything done, but nobody actually requested. No doctor requested, and then the patient gets scared because she had all of these results and now she wants me to interpret all of them. So, Doc, do I have the risk for this cancer, this cancer, this cancer? So make sure you discuss first with your doctor on the appropriate test to be done for you, specific for you. And this can be done during your general checkup, if it's screening, meaning there are no symptoms, you're feeling okay. So this can be just a part of your annual general checkup.
Okay. Thank you, Dr. Marquez. That was very clear. One of the questions from our participants also, can myoma develop to cancer? Maraming may myoma. Can myoma develop to cancer?
No. It's actually a benign tumor.
Okay. Can palatal tumors be dangerous?
Has this been biopsied? Okay, so there are benign and cancerous tumors of the palate.
Okay. All right. So I'll go to our last question. We thank you all for all of these questions. I think for the remaining questions that have not been answered, maybe we can email Dr. Marquez or Maxicare. Can we do that for the pending questions? Or maybe Dr. Marquez can answer in the chat box for all the remaining questions. Let's just take on the last one. So an anonymous attendee asked, we lost our father to penile cancer. It was diagnosed at a late stage. What do you think was the main cause of this? And I think the other question is, does it mean I have a chance also to have a cancer? Siguro having a penile cancer in the family, does it pose a familial risk of cancer for the family members?
I think penile cancers are more of the acquired or spontaneous type of cancer, so not really hereditary. So it may be due to some exposure to carcinogens or even infection.
Thank you very much, Dr. Marquez, for gracing the question of our participants. Thank you to our participants. No, you had very interesting questions. No, um, okay, so we have one more question. No, this is last question na talaga. Promise. Um, is the fit test different from the usual stool test that we usually have in our company's annual physical exam? This is an important question kasi colon cancer is a screenable cancer. So let's squeeze this in.
Okay, I think you have to check, no, with your company what kind of stool test you have been doing. But usually, if it's just the routine checkup, they just do the fecal. Maybe they just do the fecalysis. I'm not sure if they will always include the occult blood test. So FIT test is a little bit more sensitive than the FOBT test. So kindly you need to verify, with your companies. What do they include in your annual checkup? Is it the routine, just fecalysis or stool analysis test, or does it include the occult blood, or is it a FIT test? FIT test is also more expensive, I think, no?
Okay.
But more accurate. And it's just once a year.
Highly available in our hospitals, Dr. Marquez? Okay, so FIT is available in hospitals. Again, thank you very much. Thank you, Maxicare, for this invitation.
Thank you.
Thank you so much, Dr. Pampatdu. You had just a really difficult job going over all those questions. And you're right, we still had so much more. And I'm glad that all of you came here to listen to Dr. Cherry Marquez's talk, because it is our National Cancer Awareness Month. So I'm glad that Maxicare and we are all part of it. And we are now made more aware. To our dear attendees, thank you so much for participating in the Q&A and for being so engaged throughout this event. To our Maxicare members, we invite you to all please take a few moments to answer a feedback form after this event. Already, you're going to see a QR code on the chat that we will put there, so you can just copy paste, but also on your screens right now, there's a QR code that we're flashing. And of course, your feedback would be most appreciated. Of course, as much as we wanted to answer all those questions, I guess we'll just have to invite you to the next talks that we have for Maxicare. It's always this engaging, so make sure you guys stay tuned for the next ones. Now, did you know that apart from today's helpful session, Maxicare continues to provide ways for you to live your best life? They will soon be launching the Maxicare's Maxi Life Wellness app, which has programs that target specific body needs and help in prevention, control, and treatment of diseases like hypertension and diabetes anytime and anywhere in just a few clicks and taps. Watch this video. App is just so amazing. Imagine, mababawasan ang pag-set mo ng appointments in the hospital, and you can now take better care of your health, especially if you have hypertension and diabetes, using this app. And like what I said earlier, it's convenient because you can stay active, eat healthy, and take control of your lifestyle choices. There will be exclusive recipes, information about pre-diabetes and diabetes, and you'll also be able to measure the impact of your physical lifestyle to your health. Impressive. This app will be available for download very, very soon on the App Store and Google Play. And I myself, I'm excited to download it. Now, we know that many of you members deal with diabetes. Because Maxicare wants you to live your best life, they have partnered with Abbott to provide its members life-changing technology to improve diabetes care and management. Know more about it through this video. Monitoring made quicker, easier, and painless. Here's a QR code so you can find out more about it. Eligible members get it for free, so make sure you register now. It is a life-changing technology to improve diabetes management. You can do it without finger sticks, and you can automatically measure, capture, and store glucose data for 14 days, and it is clinically proven to lower your HbA1c. So make finger pricking a thing of the past, as you can now check your glucose levels using a painless 1-second scan with the Freestyle Libre Flash Glucose Monitoring System. Now, here are last two real quick poll questions before you go. If you've been to our Maxicare events in the past, you know how it goes, right? Here is our first poll question before we end. It's a yes, of course, or oo, syempre. Do you want to live your best life? I haven't seen anyone who was negative about this question, because we are all here for a purpose, right? We all come to these events because we do want to live our best lives. And of course, it's a resounding yes. Maski isampay ko pa yung oo dyan, positive pa rin. But thanks so much for your enthusiasm. We really appreciate it. And this is why Maxicare keeps doing this. Now, they want to know which topics or activities would you like to see in the next Wellness Fridays. And you can choose more than one, because it isn't just about your physiological health. They also want to know if you'd be interested in homeschooling, parenting habits, which are correlated, managing stress and emotional distress during and after COVID-19, strengthening immunity against any diseases, or taking better care of the skin. Especially summer's upon us, that might be a really good topic. So, ano ang mga activities or topics na gusto mong malaman? A lot of people are looking for managing stress and emotional distress during and after COVID, and of course, ways to strengthen immunity against any diseases. Well, we hear you, and we appreciate you taking the time to answer these poll questions. Now, if you enjoyed this experience, please do share it on your social media using the hashtag Live Your Best Life and hashtag Maxicare Wellness Fridays. And you can also tag Maxicare on their Facebook at Maxicare Healthcare Corp and on their IG at Maxicare Healthcare. Don't forget, at Maxicare Health and Wellness for their health and wellness specific content on IG. Of course, you can tag them when sharing about your wonderful takeaways from this event. Don't forget to subscribe to their YouTube channel as well, and that's Maxicare Healthcare Corporation. To learn more about Maxicare's products, please visit www.shop.maxicare.com.ph. That's where I told my aunt to go to, or you can also send a message to them through their FB Messenger. Very accommodating, very fast. If you guys have questions about Maxicare's Wellness Fridays, you may also send an email to Maxicare webinar at maxicare.com.ph. I guess I'll see you guys at our next Maxicare Wellness Fridays event, which will be on Feb 19, where we will learn more about the heart. Yes, the heart in time of COVID-19 with Dr. Rodney Jimenez. We will have a change of time slot for that one. Please do note, all right? And that event is going to happen at 12 noon instead of our usual 10 a.m. Again, that's on Feb 19, and it's going to be at 12 noon. The QR code for the registration is already here, being flashed on your screens right now. So do take the time to take a photo of the QR code or go straight to it. And also, we don't have the poster for it, but I want you guys to mark your calendars already for Feb 25. Can you guys put it on your calendar for that one? It'll be at 5 p.m. We will get to talk about emotional first aid, managing stress and emotional distress during and after COVID-19 with Dr. Ed Tolentino. See, we are listening to you guys, and we're quickly reacting to what you guys are looking for. Well, that ends our event for today. Thank you so much for being with us this Thursday morning. Of course, it's going to be a great long weekend. I hope you guys enjoyed and you were able to take away meaningful information that you will continue to think about as you all live your best life. Thanks again, everyone. Have a great day. And we know that with Maxicare, yes, you can live your best life.